Hi, my name is Sydney Sultanreich, and today I'm going to be demonstrating how to give a subcutaneous injection. So there are three sites you can use for subcutaneous injection. The first is going to be the outer posterior aspects of the upper arms, the abdomen from below the costal margin to the iliac crest, and then the anterior aspects of the upper thighs. So those are the three sites you can use for a subcutaneous injection. And you want to note that you wouldn't give more than 1 ml for a subcutaneous injection. So now I'm going to go ahead and get started. So the first thing we're going to do is we're going to verify that we have an order from the physician. So I have my paper chart and I have my med sheet right here. So in the paper chart, Anna Polowowski, that's the patient. Her birthday, 05/05/1957. She has allergies to penicillin and reacts in hives. And then we do have an order to give B12 subcutaneously, 500 micrograms for today's time and date. So we did our first check of the 6 rights, making sure it was the right patient, drug dose, time, route, and documentation. We acknowledge that they have allergies and that we verified that they had an order. So now we're going to go ahead and, and the reason why they are given it is they have a vitamin B12 deficiency. So now I'm going to look into my my med sheet, and for vitamin B12 patients getting this for their deficiency, we want to assess any edema, pallor, or changes in level of consciousness. And some adverse reactions might be diarrhea, itchiness, edema, and headache. Okay, so now we can go ahead and go over to the patient's room. So we're going to knock before entering, we're going to wash our hands, and then we're going to assess the safety of the room. So making sure there's nothing on the floor, the call light was within reach, their belongings are nearby. We're going to pull the curtain to maintain privacy, and the bed's the lowest position. So I wash my hands before entering the room. I'm going to go ahead and say, hi, my name is Sydney. I'm going to be your nurse today. Have you verify your name and date of birth? And they're going to say Anna Polowowski, 05/05/1957. I'm going to ask if she has any allergies and the reaction to it, and she's going to say penicillin hives. So now I'm going to compare what she told me with my paper chart and check it with the ID band and allergy band to make sure that they all match, and they do. Okay, so now I'm going to tell her why I'm here. So Mrs. Polowowski, I'm here today to give you your vitamin B12. It's for your vitamin B12 deficiency. You might experience some headache, itchiness, diarrhea. If you're experiencing any of those, please let me know as soon as possible. And then I would go ahead and assess the patient. So they're not pale right now. They are conscious. Gonna ask her if she has a headache or how she's feeling. Assess the pain. She's feeling okay. So now I educated the patient on the med. I told them why I was here. I did any prior assessments. So I'm going to ask her if there's anything else that she needs before I go get the med. She's going to say she is okay. Again, I'm going to make sure call light's within reach. Her belongings are nearby. So I'm going to tell her, okay, I'm going to be right back. I'm going to go get the med. So now I'm leaving the patient's room. I'm washing my hands when I'm leaving. And now I'm going to head over to the medication room. So I'm in the medication room right now, so now I'm going to gather my equipment. So my syringe, gloves, alcohol swab, vial. And so for an average size person, you can use anywhere between a 1 to 3 ml syringe. That's between 1 to 3 inches in length for the needle and between 21 and 25 gauge. Based on the patient's size. So, and then we know that it is, we don't want to give more than 1 ml for a subcutaneous injection. So today I'm using a 22 gauge, 1 inch, 3 ml syringe. Okay. So I got my syringe right here. I'm going to get my vial and I'm going to check the expiration and checking for particulates. And this one looks pretty good. I'm also going to note that it was a multi-dose vial, that I would label it time, date, and initial, but I'm going to pretend that this is a single-use one for today. Okay, so I have that. So now I'm going to go ahead and I'm going to do my second check of the 6 rights. So Anna Polowowski, 05/05/1957. She has an order today vitamin B12 subcutaneously, 500 micrograms for today's date and time. So then we're going to acknowledge that there are calculations we have to do for this medication, so we're going to go ahead and do that. So we're going to turn micrograms to milliliters. So I got 0.5 mLs, and we know that is safe because it does not exceed that 1 ml. So we did our calculations, we gathered our equipment, we did our second check already, so now we can go ahead and prepare the medication. So again, I'm going to wash my hands, and I'm going to grab my stuff. So got my vial right here, and I'm going to open up, pretend like this wasn't open already, my syringe. So again, you want to, at eye level, you want to pull back the amount that you're giving. So I'm going to pull back 0.5 mLs of air into the syringe at eye level. Okay, and you want to make sure you're not touching the inside part of the plunger. Okay, so do that. I would alcohol swab first the top of the vial for 30 seconds. After popping off the top, so let that air dry. You want to make sure you get that pretty good so you don't introduce new bacteria into the vial. So I washed my hands before. I would wash the top for 30 seconds, letting it air dry. I pulled back the air. So now I'm going to uncap using rainbow technique. Okay, so now I'm going to go ahead and insert the needle. And you want to push the air in, air to air. And then you're going to flip it around, and you want to be careful when doing this. You don't want to bend the needle. So again, you're going to flip it upside down, and you're going to have it at eye level, and you're not going to touch the plunger. And you're going to aspirate 0.5 mLs at eye level, okay? Okay, and then we would discard of that in the popper bin. And then to recap, we would do it like this. Okay. So multi-dose, we would label it time, date, and initial. And then for the syringe, we're going to go ahead and tap if there's any air bubbles. Okay, looks pretty good. And then we would label the syringe with the patient's name, the drug dose, time, date, and then my initials on here. Okay, so we gathered our equipment. I checked for the expiration. We know it's safe to give. We did the calculations, the second check. Okay, so now we labeled everything, so now we can go ahead and gather our stuff and head back to the patient's room. Again, knocking before entering, washing our hands, and then before we even touch the patient, we're going to go ahead and do our third check of the 6 rights. So again, Anna Polowski, 05/05/1957, an order for vitamin B12 to be given subcutaneously, 500 micrograms or 0.5 mLs for today's time and date. And then, okay, so we did our third check. We know it's safe to give. So now we can go ahead and position the patient. So I'm going to have the patient sitting up and having their arms relaxed at their side. And then I would wash my hands, and I would put on my gloves. And then I'm going to be using the outer posterior prospects of the upper arm. And we're going to do the pinch method, so it depends on how much skin you can grab. So if you can pinch 1 inch of skin, you're going to go in at a 45-degree angle, and if it's 290. So we have our patient's arm right here. We're going to go ahead and we're going to clean the site for 30 seconds, and then we're going to let that air dry. And then we're going to grab our needle, and we're going to uncap it. We're going to pinch the skin, and I can pinch 1 inch. So I'm going to go in at a 45-degree angle. I'm going to hold it like a dart, insert it, and I'm going to inject slowly. And then I'm going to release it. I would hold it in there for 5 to 10 seconds, and then I would pull it back out, and then I would engage the safety, but I want to reuse this needle, so I'm just going to recap it. So you would, release the skin, and then you would recap it doing this again. And then you would blot if there was any blood, you'd put a Band-Aid on there. And then you would go ahead and document that you have given the drug. So this patient gets this medication once a month. So, but if it was their first time getting this med, I would stay with them for the first 15 minutes, and I would assess if there was any changes in level of consciousness, any pallor, edema, anything like that. So this patient is good. I documented that I had given the med. I'm going to dispose of the needle in the proper bin, get rid of all of my stuff that I brought in that I can throw away. Again, I'm going to remind the patient if they're experiencing any of the headache, diarrhea, anything like that, to let me know as soon as possible. I'm going to assess the safety of the room, so making sure the bed's in the lowest position, that they have their call light. I'm going to open up that curtain. I'm going to say if they need me at all, again, use a call light, and I'd be back to check on them in a bit. And then I would wash my hands, palms